Hi, hello. Thank you for watching this video. My name is Nurse Choma. I'm the founder of Choosing Nursing over at choosingnursing.net. We're here to help you to succeed in your career as a nurse. So whether you're taking your NCLEX exam, whether you have passed your exam and you're working on your nurse practitioner certification, or whether you just need help navigating life and really trying to identify, okay, what are the steps that I need to take in order to, live my best life. That's what we're here for. I'm a nurse that helps nurses. So today I'm going to be talking with you about 10 different things that you need to know about pharmacology. So whether you are in nursing school or you are you finish school, you're preparing for the test, or you're working, these are some things that you should be fully aware of in any capacity, any role, because medications at the end of the day is what puts our license at risk, right? It's medication errors. It's things that we're not aware of that can negatively influence the outcome of one of our patients. So we're going to go ahead and go into this subject today. So if you think this is information that somebody you know could benefit from, please do share this video or tag them in the video while the videos are available, because I don't always keep every single video up on the page. Now, if you're watching this from YouTube, thank you for watching from YouTube. Make sure you go ahead and subscribe to our YouTube channel, which is also called Choosing Nursing. And I promise you get great information like this. Also, I want to encourage you to download our pharmacology guide. This is a free guide. It's actually not just a free guide, but it's also an email course as well. So what that means is that you're going to get this 9-page guide, which is where I go over like what are the drugs you need to know, how to learn the drugs. It's called How to Master Pharmacology. So what are the drugs you need to know, how to learn like antibiotics, also how to learn dosage calculations, high-risk medications, just a number of different things that you need to know about pharmacology. And in addition to the guide, you also receive videos as well. Like I send you a video showing you how to actually do the dosage calculations via email, right? So you get all this stuff via email along with the guide. So if you want to download this today, go to the link in the title of this video, which is farmfreebie.choosingnursing.net. All right, farmfreebie, or I'll put it actually also in the comments below this video. So depending on wherever you're watching it, go to farmfreebie.choosingnursing.net to download this today. So, and then the other announcement as well is that if you desire to improve your life, right? If you want to really take things to the next level in your career, maybe you feel like there's a hurdle in your life, you feel like you're not progressing, you don't know what you're doing wrong, you don't know what you're missing, then I want to invite you to join our challenge. All right, so we're having a nursing challenge. This is a challenge to help nurses really just kind of put things into balance in the area of your career, and helping you to uncover and unlock, who you really are, what is holding you back, what are some things that's been programmed into your mind that you don't realize is negatively influencing your ability to progress and get to the next level. So this is what we're going to really be talking about in this challenge. It's going to be really exciting. It's going to be so eye-opening and so beneficial to your life. If you want to be a part of the challenge, then go to challenge.choosingnursing.net. I'll put that below the videos as well. Challenge.choosingnursing.net. All right? Okay. So where are you tuning in from today? I see somebody put Jersey. Comment below and let me know where you're listening from below. Comment below, let me know where you're listening from. We're going to talk about 10 different things that you need to know about pharmacology. And then also, if you want to get more information, like beyond just the guide and the video and everything, we do have a home study program as well. And this is whether you're taking your RN exam or your LPN exam. We have both an RN prep and an LPN prep program, which has different types of plans. So depending on how long you need to prepare for your exam, whatever your budget may look like, there's different types of options, and it includes pharmacology trainings, content review, strategies, a question bank, so much information, and it really is predominantly ideal for repeat test takers. We've seen like about a 92% passing rate with repeat test takers passing our home study program. And we've been running a promotion for the past week now where it's 20% off if you use the code PASSNOW20. PASSNOW20 is the name of the code, and the code is going to be, the way the code works is that you just use it on the checkout page and you'll get the discount of 20% off regardless of which option that you use. You go to our website, which is choosingnursing.net, www.choosingnursing.net, and you click on services and choose whichever one you need, whether it's RN prep or LPN prep, and use the code, and that's how you'll get the 20% discount, which is actually expiring today. All right, so hopefully you'll be able to take advantage of that if you have not already. So let's go ahead and go right into it. And once again, I'm going to be talking about this guide as well. So if you want to get the guide, make sure you have that. And we're going to go over what are the 10 different things or the 10 different aspects that you need to be aware of when it comes to pharmacology, because it's not just one thing. And this is one of the issues, is that a lot of people, when you're preparing and you're learning drugs, you're only focusing on one aspect. So what I see a lot of people do is that you're trying to, write all the medications out and everything, and you're just like writing all the drugs out. You're welcome. Writing all the drugs out, which is good, but that's only one part of it. Knowing a bunch of drugs and the rationales is only one part of it. There's different aspects that you need to be aware of. So the first one, number one, is you need to know the medication rationales. All right. So you need to understand, and this one is kind of given. So I'm going to start with the easier side first and then move up. But you need to first know, why are you giving the drug, right? And here's the thing. There are some drugs that have two different rationales. So what you call that, there's two different names for that. It's called off-label use. Okay? Off-label use. So meaning that it's used predominantly for one thing, but then there's also an off-label use where it can be used for something else, which is still very much effective. So here's a really good example. Benzodiazepines, okay? If you're familiar with benzodiazepines, so a good example of this is going to be like Ativan, also known as lorazepam. So your benzodiazepines, what are they used for? Typically, they're used to help patients who have anxiety, right? They're used to help calm them down, relax them, especially patients that are really agitated, they're going crazy, and etc. Well, so that's the rationale use, right? That's the typical reason why doctors prescribe or give the medication, whether they're given IV or given by mouth. The other reason as well, the off-label use, all right? So meaning that it's not really on the label, but it's still used and it's still FDA approved, or it's still safe to use it that way. The off-label use is that it can also be used to treat seizures or seizure disorders. So if, let's say, we give a patient who they have seizures, and we've been giving them carbamazepine, which is a seizure medication. We've been giving them Dilatin, which is a seizure medication, and the medications, it's not really working, meaning that they're still having frequent seizures. Because the more patients have seizures, the more in the long run it's going to affect their neurological activity. So this is another reason why it's important to control and minimize the seizures, because it's not just the injury risk right then and there, but it's also the frequency of it is going to usually cut their life in half, or I should say shorten their lifespan or affect their neurological activity. So the off-label use is that in some situations, if it's not working, we can give them benzodiazepines. Ativan is a very common medication. Ativan, lorazepam, same thing. Valium, very commonly used, usually Ativan really, usually very commonly used in the event the patient has uncontrolled seizures. Okay, so that's what you call an off-label use. So when it comes to the drugs, when you're learning the drugs and you're studying the medications, don't just be aware of, what the drug is for, like, and read the rationale, but you need to also pay attention to and identify if the medication has an off-label use, another reason why it's given aside from the traditional reason that it's given. Okay, so that's the first one. That's number one, is medication rationales, including the off-label use of the medication. Here's number two. Here's the second one. All right, side effects versus adverse effects. All right, side effects versus adverse effects. So if you're just tuning on in, we're talking about how to master. There it is. How to master pharmacology. You can download this guide for free along with the e-course for free by going to the link in the bio. So the second one is side effects versus adverse effects. So a lot of people don't know that there's actually two different things. There's side effects, right? And then there's adverse effects. And then there's also different interventions between the two of them. So if you have a patient who has first let me start like this way. So what is side effects and what is adverse effects? Side effects is when you have a medication and the effect is something that we typically expect, but it's not usually enough to stop giving the drug. Okay, so side effect is often an expected effect that is not necessarily positive, but it isn't always enough to stop giving the drug. Adverse effect is going to be something that is that can actually pose a life-threatening risk, right? And so adverse effect means that if we don't stop giving it right now, they're gonna die, right? Or they're gonna go into shock, or something really bad. They're gonna be at risk for mortality. So there's a big difference between what I do for side effects versus what I do for adverse effects. So for side effects, if a patient has a side effect, we can let the doctor know, but it's not really necessary because usually we know it's going to happen and we're not going to stop giving it. But adverse effect, we need to notify the doctor right away. So here's a great example. Vancomycin. Vancomycin is a common antibiotic that we prescribe to treat infection. So a side effect would be they have, diarrhea, stomach cramping, like upset stomach. That's the side effect. I'm going to expect that. I'm not going to call the doctor and say, hey, patient's on vancomycin. And unless the patient is complaining, then maybe we can get them something for relief of their stomach, but it's not enough for us to stop giving the drug. An adverse effect would be something like red man syndrome, or they're going into like hives, which is obviously showing that they're allergic to the medication. So, and red man syndrome is usually red man syndrome occurs because we're giving the drug, the Vanco, too quickly. And that's literally where their face begins to flush and they look very, very red from the administration of the medication. So adverse effect, we stop giving it. Side effect, we don't. So a lot of drugs, pretty much every drug actually, has a side effect and an adverse effect. All right? Every drug has a side effect and adverse effect. So here's tip, right? Here's a really good tip right here. So when it comes to taking tests, when it comes to questions, a lot of questions are testing your ability to recognize the side effect versus the adverse effect. So if you struggle to know the difference, that's how you get the question wrong. Because you're not aware that that's an adverse effect, so that requires a different intervention, then that's a side effect versus a different response as well. So you have to look at differentiations. You have to look at what is the side effect of this versus what is the adverse effect. And what I would tell you, because there is a lot of drugs to know, is to pay attention to the medications that is most predominantly given or most predominantly prescribed, because there is a lot of drugs to know. So these are medications that are common because they're the common things that we see in the hospital, in the nursing home. So medications that treat high blood pressure, diabetes, infection, pancreatitis, that kind of stuff, right? And then pay attention to the side effect versus the adverse effect of that particular drug. Number 3, here's the third one. And I just realized I wasn't putting this on here as well. So let me make sure I'm typing this at the same time. But the third one, number 3, is drug administration. All right, drug administration. So let me put number 2 was side effects versus adverse effects. Okay, and then number 3 is drug administration. So here's the thing. When it comes to giving the drugs, you can't give every drug the same way, right? So drug administration is typically the route and the method and how it's given. So whether it's given by mouth, whether it's given by IV, whether it's given an IV, which is IV push or IV piggyback, right? That's 2 different things. IV push, I'm giving it over 2 to 3 minutes. IV piggyback, I'm giving it over 30 minutes to an hour. So the rate of how fast I give it does influence the outcome of the patient, and it does influence the potency of the drug. So, or I'm giving it topical, so it's just something that I rub on their skin, or I'm giving it underneath their tongue, right? So you can't give every drug the same way. There's some drugs, or I'm giving it IM, right, in the muscle. There's some drugs, if you give it the wrong route, that can actually kill the patient. So for example, Dilantin, that's a medication that's given piggyback, but it's not given IV push, right? So you have to be aware of, you have to think about it too. If I give this drug in this route, how does that affect the way the drug is distributed in the body? How does that affect the way the drug is metabolized in the body? This is how you need to think if you really want to be successful. If you really want to get the drugs or understand the drugs, how is it going to be metabolized? Because the way that it's metabolized, because if this is a drug that, let's say, changes the heart rhythm and I'm giving it push, then I need to think about all the precautions before I give it, right? So if it's going to affect the rhythm, then because it's supposed to slow down the heart rate, then they should be on a heart monitor before I give the drug. So when it comes to the drugs, the best way to learn the drugs is to understand the way that it's administered, understand how the drug actually works, understand the metabolism of the medication. If you just try to memorize the drug only, but you don't grasp the actual picture, you're going to find yourself doing it over and over again, and it's not going to stick because you're not looking at how it actually works and why we're giving it. Number 4, here's the 4th one. All right, and if you find this helpful, please share this video with somebody, tag somebody in this video as well. Number 4 is going to be parental nutrition. Parental nutrition. So when we're looking at the drugs, you need to understand why we give something. Why you need to understand that the administration of PN or PPN. So parental nutrition is typically administered by a registered nurse, not usually by an LPN. Parental nutrition, we administer that usually via a central line. Okay, so it has to be a central line or a PICC line, which is a central line, and so it cannot be given via a peripheral line, like in the hand, arm, nothing like that, because it's going to definitely, infiltrate the tissues. So parental nutrition given via central line, but then you have to think about, okay, if I'm giving it via central line, and I'm giving this medication, what's going to be the physiological effects of giving this medication, right? So many times patients that are, depending on depending on let me put it like this. Many times patients when you put them on PPN, you have to monitor their blood sugar as well, right? So their blood sugar may spike because we do put amino acids, glucose, vitamins, like a bunch of stuff that goes into that administration. If you ever seen it, it's like a huge bag. It's like this huge white substance bag in there. So a lot of times we have to do like daily labs as well while they're in the hospital. So when you're looking at parental nutrition, you need to understand the method that's given. You need to understand why we're giving it, right? Because patients, usually they can't absorb food on their own. And you need to understand what we monitor. Number 5, here's the 5th one. Drugs, as far as that you need to know, drugs that can and cannot be mixed. All right? Drugs that can and cannot be mixed. So when it comes to medications, you need to know, I don't want to say just the compatibility, but you should be aware of if it's okay to crush this drug and mix it with another drug, right? So, and that's relevant because you have some patients that cannot swallow, and because they cannot swallow, then the drugs have to be crushed first. And so if you crush the drugs, most patients are not on just one medication, right? They're on multiple medications. So you're going to crush these drugs. So is it okay if I mix if I take this drug and give it at the same time? Or is it going to have like a negative effect on the patient? All right. So you want to be aware of, can I crush the drug and can I mix it with other medications, or does it have to be given separately? This is your biggest concern with patients that can't swallow and you need to crush the meds. Now the pharmacy is supposed to factor all these things ahead of time, but we're supposed to be the last check, right? We're supposed to double check that. So that's number 5, is being aware of drugs if it can or cannot be mixed. All right. Hopefully you're doing good so far with the information. What I'm going to do after this is over is I will also post this as far as the list of the drugs as well, or the list of the things that I went over today. And then if you're wondering what the star is on the video, so Facebook just released this new thing called like stars, and pretty much it's kind of like where you can buy a star. And it's like a star is like kind of like a way of just telling me, oh, you're doing a good job, or I really like this content, this is good information. So it's similar to if you're familiar with Periscope. Periscope also has stars as well that you can buy, and that you release the stars. So stars are kind of like a new thumbs up type of thing that Facebook is doing, which is totally different, and everything. So if you feel you want to give me a star, I would appreciate that as well. But thank you though for the likes and the hearts and the shares. I definitely appreciate that as well. All right, number 6. Here's the 6th one. This one is a big one, okay? Is going to be high risk medications. All right. So in the guide, this one I won't go over too long because it's actually in the guide. I actually go over what the high risk medications are in the guide and everything, but you need to know what medications are high risk. The definition of high risk medications are pretty much, they have an increased risk of mortality if given wrong. That's what it really is. Okay, so it's medications that have an increased mortality risk if they're not given correctly. Okay, if they're not given correctly. So because of that reason, and high risk medications, there's different precautions that we implement before and after to prevent, mortality from happening. So for example, insulin is one of them. We have to check the sugar levels before we give it, right? So when you're learning high-risk drugs, what are the precautions before and after? Because that is also what influences whether or not they experience that negative outcome. Number 7, all right? Number 7 is dosage and drip calculations. All right, dosage and drip calculations. Here's what I'm going to tell you about dosage and drip calculations. So I do talk about it. I do give you a conversion table in the guide, and then there is a video where I just go over where I just talk about only about dosage calculations and drip calculations. All right, so there's a video where I actually go over that. But dosage calculations is important for dosing, especially with like babies, because with babies and infants, we have to be more careful with how much we give because they're, they don't have their kidneys are not as developed or their body's not as developed, right? So we have to be more careful with them. And then it's also important with just people in general, right? As far as like grown adults, it helps to prevent overdose, right? So even like heparin drip, right? There are certain precautions that we have to follow before we administer it. And then also just knowing, like, for example, what the weight of the patient is. This is the reason why when patients have surgery, we need to first get their weight so that way we can give the right amount based on their weight. So this is why daily weights matters. This is why you don't want to just give any old weight, right? Oh, that was the weight yesterday. No, right? We have to really be accurate because it influences the outcome of the patient because it influences the medication and how much we give of that drug. Number 8, this is number 8, is going to be food interactions. All right, number 8 is food interactions. So food interactions now is going to, and number, I believe it's on the last page. On the last page is when I talk about food interactions. The second to last page. So food interactions, there are certain foods when administered with other drugs, it either makes the drug work better or it decreases the potency of the drug. Okay? So there are certain foods when taken with the drug, it either makes the drug more potent or less potent, which is the reason why you have to know what foods cannot be administered with specific drugs. And then another thing as well is that because of the outcome or the side effect of the drug, you want to be aware of what you cannot do, so to speak, or what they cannot eat, or what they should eat. So if let's say if a patient's on Lasix is a medication that causes them to lose a lot of potassium. So if they lose all that potassium, then we need to make sure that they eat foods that are rich in potassium. So now you need to know nutrition, and you need to know what foods have a high potassium level. So you have to study nutrition as well, all right, when it comes to the medications and how it interacts with certain types of drugs. Number 9 is going to be how drugs affect certain ethnicities. All right, that's number 9. So there's different drugs that influences that has more of a negative or positive or more of an effect on certain ethnicities than others. Okay, so for example, let me give you a good example here. People that are of Chinese descent, this is from me on my notes, they typically require lower doses of benzodiazepines because they're more sensitive to sedative effects. All right, so that's interesting, right? Isn't that interesting? So people of Chinese descent typically require lower doses of benzodiazepine, typically like diazepam or Valium, and they tend to be more sensitive to sedative effects. So this is important because when you are when it comes to the exam, we have to demonstrate, and when it comes to nursing, we have to demonstrate what you call cultural sensitivity. All right, culture sensitivity. We have to be sensitive to the patients, and then we need to also understand that not everybody's going to process certain medications the same way. Now, inside the home study program, in the RN home study program, I do actually go over, this teaching in detail, where I go over, like, okay, people of Chinese descent, people of African American descent, people of Mexican American descent. And so I definitely do go over the different ethnicities in more detail. So I would encourage you, if you do not have that program, if you get the 20% off deal, which expires today, you can use the code PASSNOW20, and the link is rnhomestudy.choosenursing.net, rnhomestudy, or go to our website, choosenursing.net, and click on services. As long as you use the code PASSNOW20, and you'll be able to get the 20% off deal on either of the 4 options. If you do the 6 months and the 9 months option, you'll get bonus courses and a question bank. If you do the 3 months and the 30 days option, you will get the actual whole program, which does include 7 assessment tests. It does also include 2 exams, and then it also includes like several trainings, video trainings, including what I'm talking about right now. But the 6 months and the 9 month option includes bonus courses and a question bank. Hello, welcome. Here's the last one. Number 10 is going to be opioid use. All right. Once again, if you found this helpful, make sure you share this video, tag somebody that would benefit from this. The last one is going to be opioid use. So, we have an opioid crisis, right? We have an opioid crisis. So you have to, because of that reason, you need to know what medications are at risk you need to understand what is the consequences of medications or narcotics that are misappropriately used. You need to understand tolerance. You need to understand dependence, right? You need to also understand what happens over time if they keep taking these opioids. Like, what does it do to their GI system, right? What does it do to their level of consciousness? What do we give in the event they're not waking up, right? What do we give if they're not waking up? What do we do if they're not responding? Because that happens a lot. What are the signs that they're near overdose? What signs are indicating the patient is experiencing or can experience overdose within the next 6 hours if we do not do something differently, right? If we do not change the frequency, if we don't give them the reversal agent, right? One of the things that you need to know is their vital signs. Their blood pressure will begin to drop. That will begin to go down. So you need to pay closely attention to their vitals to patients that are on opioids, because there is a huge risk, and this is why doctors are typically careful when it comes to giving opioids, narcotics, to patients. There's a huge risk, not just short term, but also long term as well, right? So I want to encourage you once again to download this free guide. You get the guide plus also the e-course as well, where I go over and you get notes, and there's a video training where I go over dosage calculations. People have found it very helpful, very informative. There is also a pharmacology cheat sheet as well. So the cheat sheet is longer. The cheat sheet is about 50 pages long, and I go over the drugs in a lot more detail. This guide, which is about 9 pages, plus also the e-course as well. But if you want to get the cheat sheet, you'll see that as well after you download the guide for free. All right, so that was it. Thank you for watching this video. Sign up for the home study program. There's also LPN prep as well as RN prep. If you visit our website, www.choosenursing.net, and click on services and use code PASSNOW20 for either of the RN prep or the LPN Prep program to get the discount that expires tonight at midnight. Thank you for watching, and I'll see you the next time.